All right. Well, good evening, everyone. Welcome. My name is John Mirasola, and I work for the foundation and work mostly with communications and client support services. Our topic tonight, entitled "You've Just Been Diagnosed with Epilepsy or a Seizure. Now What?" Is what we're here for. Speaking about it is epileptologist Dr. Elizabeth Felton, who you'll meet in just a minute. And she's from the University of Wisconsin-Madison Hospitals and Clinics. Just a
Hi everyone, I'm Elizabeth Felton, and thank you for the introduction. I am one of the epileptologists or epilepsy specialists at the University of Wisconsin-Madison Department of Neurology. My special interests within epilepsy are pediatric to adult transition, women's issues, and the ketogenic diet. But today I'm going to be talking to you about things to consider if you're recently diagnosed and how to talk to your doctor, what questions you may want to ask. So I'm going to try to share my screen. There we go. John, just let me know if I'm not showing the correct one. So recently diagnosed with epilepsy or seizure, now what? There we go. So a couple assumptions for this presentation, that you've been told that you have had an epileptic seizure and or that you have a diagnosis of epilepsy. I'm not going to get too into the details of the definitions of seizure and epilepsy. If you have questions about that, I can talk about that later. And then also assuming that you're getting ready to see a neurology provider about this information. So when I use the word provider, that could be a neurologist, which is a physician, or sometimes you may see a nurse practitioner or a physician assistant who has a specialty in epilepsy. So here's some things that you may want to do when you're preparing for your appointment. Number one, you want to make sure the clinic has your medical records. Typically, when you make an appointment, they will try to have you let them know where you've been seen. You know, if you had been seen in the ER, if you had, records somewhere else, you can just call and make sure they have all of that on hand. If there are records that you have, you could send them or fax them in advance. The more information that the provider you see has in advance, the better. Second bullet, find out who you will be meeting with. So likely, you get a new appointment, so in my case, you have an appointment with Dr. Elizabeth Felton. You can easily put my name into Google and you can find the UW Health website that has information about who I am, where I've done my training, the special interest that I have. It may just make you feel more comfortable going into the appointment, learning a little bit more about who you will be seeing that day. I highly recommend, whether it's the first visit or your 20th visit with the person, that you write down your questions. Undoubtedly, leading up to the appointment, you're going to be wondering about different things. For your very first visit, you're probably wondering, am I going to need to be on medication? What does this mean for, my work, my driving? Write all those down. Even if you think like, oh, I'll remember it, inevitably, you're going to get into the appointment and you may forget to ask a question. And so just write them down. And I always recommend prioritizing them. If you have 10 questions, you may not have time during the visit to get to all of them. And so you want to make sure you have your most important ones listed first. If your priority is knowing, can I drive or not, have that be your number one question. And if there's a less important question, have that further down. And then have anything that you want to show the doctor or the provider ready. So if somebody took a video of you having a seizure, or if a partner wrote down an account of what they saw when you had the seizure, have that ready. Have your phone ready with the video, have that description ready, particularly in this day and age with COVID, where there are oftentimes restrictions on who can come to the visit. So if you're having an in-person appointment, you may not be able to bring a support person with you. And so having their account or information from them ready is very helpful. And then consider having someone join you. Again, if it's allowed, you may not be able to have a support person in person, but you could also ask, could I call my spouse during the visit and put it on speakerphone so that they can hear the information as well. Or if you do a telemedicine visit, you can certainly have somebody there with you, or even if they're not physically with you, usually the telemedicine appointment links can be sent to another person so that it's kind of like this, like a Zoom meeting where there are multiple people, the physician, you, and somebody else. And you would task that support person with listening, taking notes, and making sure that all of your questions get answered, or at least the high priority questions. What to expect at the appointment. So typically, if this is your first appointment, some history gathering from you and outside records. They're going to ask all about your seizure history, kind of what happened, things from the past. They'll review any data that may be available. So at your first visit, you may have already had an EEG or MRI, or perhaps you had a first visit after having a seizure and those studies have been ordered, and now you're coming back to hear about the results of those. Typically, there'll be some conversation about the diagnosis or what the physician or provider thinks about what they have gleaned from your history and the results that are available. And then there'll be a discussion of the next steps. Every case is different. Next steps may mean we need to start a medication or some other treatment. It may be getting more testing, or just wait and see if this happens again. And so there'll be some discussion of that. And then there'll be some time for questions at the end. Typically they'll say, what questions do you have? And then that's your opportunity to ask questions. Of course, you can ask questions as they're going along as well, but typically there's some time at the end for questions. It is helpful if you do have many questions to state up front, that you have some, and sort of have those out and ready so that the provider is kind of prepared, and that they also budget their time during the visit to allow some minutes at the end for you to be able to have some time for Q&A. Now, what questions might you ask? I'm throwing out a whole bunch of example questions here. Some of these may or may not pertain to your specific situation, but just some examples, and I'll maybe talk about some of these. So, do I have a diagnosis of epilepsy? What type of epilepsy do I have? Perhaps this would have been covered during the conversation, but sometimes not. Sometimes the conversation is a little bit more general, and the physician doesn't state outright that you have a diagnosis of epilepsy. I've seen patients who do have a diagnosis of epilepsy from long ago, and I see them for an initial visit because maybe they've moved to the area or something like that. And I reference them that they have epilepsy, and they say, "What? I've never heard that. No one's ever told me that before," even though it's in their records. And so sometimes the physician or provider kind of doesn't state outright to the patient what their diagnosis is, and you have a right to know that. So just ask, what is my diagnosis? If it's epilepsy, what type of epilepsy do I have? And do you know what the cause is of my seizures? There's a lot of different reasons that people may have seizures, and some that we understand and some that we don't. And you can see if they have a sense of that. Knowing what your treatment options are. And I have another slide that I'll talk about questions that you may want to ask about medications, but there may be other treatments besides medication. And while they may not be a consideration for you right now, it may be something down the road. And so you may want to ask, like, what are all the treatment options available for people with epilepsy? Then these next two talk about activities. So do the seizures impact my ability to work, or do XYZ activity? So say you really enjoy swimming or going to the gym, or driving a golf cart. So you could ask if those activities are okay with your diagnosis. For work, if you operate heavy machinery at work, is that okay for me to continue doing? And then if it's not, what steps do I need to take? When can I drive? Typically, people cannot drive for some period of time after they have had a seizure that involves loss of consciousness. In the state of Wisconsin, that's 3 months. It's different in other states. And so you would want to ask specifically when you can drive, if that's something that you want to be able to continue doing. And then what should I tell others to do if I have a seizure? If you have had generalized tonic-clonic seizures, also called a grand mal seizure, where you fall and have convulsions, you may want instructions on what you should tell people to do if they see that happen. And then seizure triggers that you should be aware of. There are general seizure triggers, but there are some types of epilepsy that are more sensitive to certain triggers than others. For example, there are certain types of epilepsy that are more sensitive to alcohol. And so I tell patients with that specific type of epilepsy that they need to be very careful with alcohol. So just knowing seizure triggers in general and ones that may be more for the type of seizures or epilepsy that you have. And then, if you want to know more, where can I read more? What would be a good source for me to go to if I want to read more information about this myself? And then some logistics questions that you may want to ask. Should I go to the ER when I have a seizure? With somebody who's had a first seizure, oftentimes go to the emergency room, but that may not be necessary to do every time. And you would want to get instruction from your doctor or the provider that you see under what circumstances should you go to the emergency room. And then getting a sense for what the relationship is going to be like moving forward. How often will there be appointments? And then how do you contact their office in between appointments if you have questions or if you've had a seizure or if you're having a side effect? What's the best way to communicate? Should you call? Some offices have a secure portal in which you can send an email to the clinic, just kind of knowing that. Also, sometimes it's helpful to know the structure of the clinic. Will you be in touch with the physician or provider directly when you call, or will you be talking to a nurse? And if it's a nurse, you could say, could I meet the nurse that works with the clinic? So for example, in our epilepsy clinic, there are several nurses that work with our patients, but there's a couple that are there more often than others. And, oftentimes we can introduce the patient to the nurse so that they have kind of a face-to-face of what they look like. I had mentioned I would talk a little bit more about medication. So often with a new diagnosis of epilepsy comes treatment options. And typically the first treatment option that we do is medication. Not always, but that's typical. And so sometimes you will be presented with options. The physician might say, here's 3 medications that we can consider. Here's the pros and cons of each. What do you think? Sometimes that you might be told this is the one you need to start. If there are options, write down the names of those or ask them to be written down for you. Ask about the side effects. Any medication is going to have a ton of side effects, but typically there's, 2 or 3 that are the most common side effects, and then 2 or so that maybe are more that are rare, but are perhaps more worrisome. I'll just give a quick example. Lamotrigine or Lamictal is a medication that is often used for seizures and epilepsy. And, common side effect might be fatigue or a little bit of difficulty sleeping. Worrisome side effect is that it can cause a severe rash. And so, just that kind of information, I think would be helpful when you're sort of weighing the pros and cons of the medication. If you want your physician or provider to decide for you, just tell them that, you pick which one, you would start on or which one you think is best. I typically have the approach that I talk about the pros and cons of each and let the patient have some choice if they want that. And then asking if there's interactions with their other medications. They probably have the list of your other medications in front of them. But if it's a very long list, they may not have time to be able to cross-check each and every one. And you especially want to ask if you're like a woman who's on hormonal contraception or birth control pills or injection, because there are some interactions with some of the seizure medications with hormonal contraception that you would want them to be aware of. And then another question around medication is, do I need a seizure rescue medication? For people that have long seizures or clusters of seizures, we often prescribe a rescue medication that can be given in that setting to sort of help stop the seizure or stop the cluster to help prevent the person needing to go to the emergency room. So you can ask if your neurology provider thinks that that would be appropriate in your situation. And then finally, I probably covered this earlier, but asking if there are other treatment options other than medications, and at what point would those be considered. I had mentioned earlier that one of my interests is ketogenic diet in the treatment of epilepsy in adults. That is typically not first line. Typically, it is not. Typically medication is started first, but then if medication is not working or if people are having a lot of side effects, sometimes we'll consider ketogenic diet down the line. I have found that patients often find it helpful to know, okay, there are these other options. We're not going to do it now, but sort of knowing what's ahead. And so you can ask about that if you are interested in more information. And then just a couple things to make sure that your neurologist knows about you. So if you're thinking about becoming pregnant, that is something that is going to likely impact the choice of medication. So there are some medications that are safer than others during pregnancy, and that would be something that they would want to know and consider when they're deciding on a medication. Using or planning to use hormonal contraception because of the interactions that it can cause. If you're being treated for depression or anxiety, there's a couple of reasons for that. One is that some of the seizure medications are more likely than others to impact mood. And also there are some medications in that class that are actually should be avoided in people that have seizures and epilepsy. So it's just important for them to know that, and then they can talk to you more about it. And then if you have financial constraints that could make it difficult for you to afford your medications or to pay for your appointments. Oftentimes there are copay assistance programs with either drug companies or with the clinic. And so it's important to be upfront about that. You don't want to have to make, if you go to the pharmacy and find out that your medication is going to cost you $300 a month, you don't want to just suffer and pay for that or go into debt for that. You want to call the clinic and say, I went and it was $300 and I can't do that. Is there any assistance for me? And oftentimes there are options. So please do make that known to the clinic if you are having financial concerns. And then I think this is my last slide, and then I'll take some questions. Just some, suggestions for sort of taking in all the new information. It can be a lot of information. Those first couple visits that you have, realizing that you have this new diagnosis, and that in the ways that it may change your life and things that you have to do. So if possible, have someone with you at that appointment I had mentioned, and debrief with them afterwards. Oftentimes your clinic note is available for you to review. So for example, at UW Health, it's called MyChart, and you can log on there. And once the clinic note has been signed, you can read your own clinic note. And so you can see what the doctor documented, based on what you told them and their assessment. And so you can read that. That is your record. If it's not available online, you can request it through medical records. If there are unanswered questions, so for example, I had mentioned, if you have 15 questions, there may not be time during the visit to go through all of them. You can always ask for a sooner follow-up appointment. You could say, could we, instead of following up in 6 months from now, could we follow up in a month or two so that, we can kind of check in and I can ask these other questions. It's also possible that you could ask some of your questions through MyChart or through the patient portal as well. And then just really know that there are others who have been through the same. There's support groups, including through the Epilepsy Foundation of Wisconsin. And so it's often helpful to talk to other people who have been through the same thing to provide you support. So reach out to those organizations. And then my final caveat is just to be careful about information from non-medical sources. If you put epilepsy or the name of a medication into Google, all sorts of information will come up from all sorts of sources, some of which are more reliable than others. And so you have to be a little bit careful about the information sources that you use. Epilepsy Foundation has a wonderful website with all sorts of information about seizures. You can go to the American Epilepsy Society website, and they have some patient information on there. You can ask your neurology provider what sources they recommend, and just be careful about just random websites that may come up, or Facebook groups can be very helpful for support, but not everyone's situation is exactly the same, and sometimes there can be some misinformation. So just kind of a warning about that. And that was all I had. I'm happy to take some questions. I'm going to escape out of here and stop sharing. There we go. And I'm happy to take questions. I see one in the visit here. It says, can someone record my doctor appointment so I can listen again later? So I would ask at the beginning of the visit, or maybe even before the visit, to call the clinic and ask if they would be okay with that, with you, on your phone recording the visit. And I would just ask.
Okay. First of all, thank you, Dr. Felton.
Sure.
That was terrific. We do have another question here. If someone is getting a second opinion, do they need to tell the doctor that's why they're there?
Oh, that's a great question. Yeah, I would let them know that that's why you're there. They probably will know that already. Typically when patients, because typically you need a referral for a visit, and typically on there it will say second opinion. And whenever there's a second opinion, I want all of the records from the first opinion. And so typically that will be known in advance, and we will have collected the outside records from whoever you had seen first. That is pretty standard. I also want to make another comment about second opinions, that you should never feel bad about seeking a second opinion and even telling the first person that you saw that you want to do that. That is okay. If a patient tells me, you know what, I'm going to go to Mayo or Cleveland Clinic and just get another opinion, I'm fine with that. I mean, that's sort of something that people do, and you shouldn't feel like you need to hide that from anybody or feel bad about it or that you're insulting anybody.
Okay. And there's another one here. What should I do if I am really scared? What are the resources out there?
Yeah, I mean, being scared is a very natural response to receiving bad news. You receive this news that maybe is surprising to you. And so I would, number one, ask your doctor if they have suggestions. The Epilepsy Foundation support groups would be a great place to go, because you would get connected with people that are undergoing the same thing. When patients tell me that they are feeling, depression or anxiety, or, feelings that they're having trouble understanding that are specifically related to the diagnosis, to the health issue, I will often refer them to health psychology. It is a type of therapy, but it is about when you are having feelings that you need help managing around a diagnosis. So some people have depression or anxiety that is separate, from the diagnosis, but some people have that specifically related to the diagnosis, and health psychology can be really helpful for that.
Okay. And one other one. What should I say to the doctor if I am not happy with the treatment or disagree with it?
So I think you just need to be upfront with that. So, I mean, I guess the disagreement could be about different things. I mean, so it could be because you're having, I'll just throw out some different scenarios. Perhaps they have recommended a treatment and you have side effects from it, and they tell you to tough it out, but you don't want to tough it out. Just tell them, I cannot be on this medication anymore. I want to change the medication. If you disagree about being on medication at all, that's a little trickier. If you have a diagnosis of seizures or epilepsy, it is, the general medical opinion that you need to be on some sort of treatment for it. And typically that is medication. Now, I've mentioned a couple times, I do ketogenic diet. That's typically not first line, but if somebody is adamant that they will not do medications, then I will sometimes, we'll talk about other treatments like ketogenic diet. I'm trying to think of other ways that you may disagree with the treatment. Typically there is some back and forth about it. And, if you are offered one medication and for some reason you don't want to be on that medication, so say you're recommended medication X and you look it up and you read the side effects and you're just saying, I cannot do this medication, ask what your other options are. You can always ask that. And if you're not getting the response that you want from that person, you can always ask for a second opinion. Now, it is possible, it's, I think, very common that in a second opinion, the options don't change very much, but sometimes they do. And maybe it would just be helpful to hear it from another person.
Okay. Another one here. What is the difference between an epileptologist and a neurologist?
Great question. So an epileptologist is a neurologist who has had additional specialty training in epilepsy. So all neurologists have gone through 4 years of residency training, a 1-year internal medicine internship, and then 3 years of neurology training. And then everyone who's gone through that is a neurologist. And then some people have done additional training in stroke or multiple sclerosis or ICU or epilepsy. So I personally have done a 2-year epilepsy fellowship. You can also there are 1-year options as well. And it's just additional training in that area. And then there is a separate board certification for that. So I am board certified in neurology and I'm also board certified in epilepsy. There are many more neurologists than there are epileptologists. And so many general neurologists will treat patients with epilepsy, and they do a great job at that. A lot of patients that are referred to epileptologists will have already seen a neurologist, and the seizures are more difficult to control. And so then they are referred to an epileptologist for another review or to talk about, other types of options. So for example, a general neurologist is probably not going to be guiding a patient who needs epilepsy surgery. They would most likely be referred to an epileptologist. But for somebody that has had, say 2 seizures and they're started on a medication and they don't have seizures anymore, they could be managed very well by a general neurologist.
Okay. And another one here. How is an EEG and an MRI used in the diagnosis?
Okay, so, when there is a person has a seizure, typically we are wanting several pieces of information. So one is to know what happened with the seizure. What did it look like? So the description from, an onlooker who saw the seizure, or with if you remember your seizures, what happened during it? What were the feelings that were leading up to it? So that's one piece of data, sort of the, what happened during it. Another piece of data is the EEG, so the brain waves. And so we will typically get an EEG, and that often will give us clues about the epilepsy. So we might see what we call epileptiform activity, even in between seizures. So if you have an EEG, even if you're not having a seizure, we may see some clues on the EEG that of where the seizures are coming from. So often there's an area of the brain that is irritable, and we'll see evidence of that irritability by this epileptiform activity on the EEG. And so, for example, if we're seeing that on the left temporal region, that's suggestive that the seizures are likely coming from the left temporal lobe. So that's what the EEG tells us. And then the MRI gives us a picture of the structure of the brain. And we may see an abnormality in the region that the seizures are coming from. So for example, in the person that we see some left temporal epileptiform activity on the EEG, if we see a finding, an abnormal finding in the left temporal lobe, that's another piece of data that's kind of lining up, showing that these are likely left temporal lobe seizures. So it just gives us additional information when we're sort of trying to make the diagnosis and knowing, do you have epilepsy, yes or no? And if yes, is what type of epilepsy it is. So left temporal lobe epilepsy is one type of epilepsy.
Okay, looks like there's one more. If I get diagnosed and out of medicine, can we check my insurance before I leave the doctor's office?
Yeah, so that often can happen. It depends on your clinic. So I'm really lucky in my clinic. We have an epilepsy clinic pharmacist who works there. Not all clinics have that. Where I did my residency training, we did not have a pharmacist embedded within the neurology clinic, but we do here at UW. And they are able to do what's called a test claim, where they kind of like ping your insurance with the request for the medication, and then it will bounce back a response on if it's covered, how much it will be. And in some cases, something called a prior authorization is needed, where they're not able to say yes or no right away, that they have to do some additional review to determine if it's going to be covered. And that can often be done before you leave the doctor's office. Sometimes it may take like a day to do if the pharmacist isn't available or if they're not able to get into the system. But that can be done. Some medications we know are going to be more than others. And so for some medication, I know they're generic and they're likely inexpensive and covered by insurance. And so I'm less likely to do a test claim for those versus the ones that are newer and perhaps are not on generic yet. And in those situations, I will often just say, like, I'm not even going to prescribe this until we do the test claim, and we'll see if your insurance will cover it.
I'm just going to piggyback on that and also add to our listeners. The Epilepsy Foundation is not in a position to help financially, but we have a lot of information about alternative ways to get medicine. Okay. Again, we're not a medical agency, but we have a lot of information on that. And so please, get in touch with us about that. Looks like there's one more. Can medication eliminate the episodes or just reduce these occurrences?
Yes, that's a great question as well. So medication typically is, I guess, increasing your seizure threshold. So it's making it less likely that you will have a seizure, but it cannot, it may not be 100%. For some people it is. So some people, we start on a medication and they're seizure free as long as they're taking that medication. Some people have a significant reduction in their seizures, but they still have some. And in those situations, usually we work to see if we can get a person seizure free by either switching medications or adding a medication. But everyone is different. The seizure medications do not eliminate the epilepsy, but they are typically able to raise that seizure threshold, making it less likely that you will have a seizure.
Okay. Thanks for attending tonight. Dr. Felton, thank you very much for giving us your time.
Absolutely.
It's been terrific having you. Okay. And that ends our presentation. Good night, everyone.
Thank you. Good night.